Okay, great. And again, welcome everybody to today's section on obesity prevention and management at-home strategies. So what I'd like to do is start with a little group discussion with the first question being, what could happen when we don't watch our portion sizes or the calories that we eat? What could happen? Gain weight. That's the main thing that people say, right? So we gain weight, we can't fit into our clothes anymore, all those not so nice things. So, so what are some of the health risks associated with having too much body fat? Health risks associated with having too much body fat.
Diabetes.
Pardon?
Diabetes?
Diabetes, good. That's a direct correlation, by the way. Because it's interesting that people who have bariatric surgery, once they start losing all that weight, if they've had diabetes to begin with, once they start losing all that weight, diabetes, I forget the percentage, but I think it's over 50% of cases, diabetes disappears.
That's amazing.
So what are some other things?
High blood pressure.
So high blood pressure. What else? If you have too much body fat, what are some health? Heart disease. Good.
Risk for stroke.
Yes. Stroke. Why? Because it's clogging up your arteries with all that fat. What else we got going on?
Respiratory issues.
Respiratory, you can't breathe as well. You name most of them. There's a few other big ones.
Would depression fall in that? I don't know.
As a mental health? Yeah,
Yeah,
absolutely.
okay.
Because, and it's like that, that's like one of those cyclic, oh, how do I want to word it? The more depressed you are, the more you tend to eat. And then you're depressed because you're eating, so then you eat more. So I've seen that a lot when I worked with the veteran obese population over at the behavioral telehealth center for a couple of years. I've seen that all the time. So definitely depression. That wasn't even on my list.
What about skeletal problems, bones, joints, things of that nature?
Because you're putting excess weight on your joints and stuff. Absolutely. A couple more. There's another big one that we haven't missed yet. So we got some cardiovascular stuff. We got diabetes, high blood pressure. Another big one.
No, I can't.
How about cancer?
I was thinking that that's related.
Absolutely.
Oh,
Yeah.
I never thought.
Cancer.
Can you explain that one to us? Or?
Yeah, I would.
No, not a medical doctor. But
I'm
I
curious.
know most of the people that I've ever known that have had cancer issues, either continued or have passed because of cancer, have by far never been heavy people.
Yeah.
Interesting. Yeah.
So I would question that one.
I'll find, and I don't know, I'll find there's specific cancers that are obesity related.
That makes
Okay.
I think like kidney and bladder
Not
and
like
all
breast
that.
or-
Okay. Well, fatty liver disease is another one.
Right.
So, liver cancer.
Yeah. Okay.
So, fatty liver. I remember a lot of times when people got diagnosed with fatty liver in the hospital, I had to go talk to them, patient health education and stuff like that. And the main controlling factor for fatty liver is a reduction in fat in your diet. Had nothing to do with anything else. So, sleep apnea. A lot of heavier folks, it's hard for them to breathe at night. So they got to be on the sleep apnea machines. Okay. Kidney disease is another big one. So basically, it really affects all organs, a lot of the organs of your body.
Even your reproductive organs, actually.
Yeah.
Oh, absolutely. So
Yeah.
pregnancy.
Right.
So when women are pregnant and they gain too much weight, a lot of times they have the gestational diabetes is a big one that I've seen a lot. So, okay, so great job on that. So, another couple things, another couple points I just wanted to mention is that a lot of people say, well, how do I know that am I too heavy, or all that kind of stuff. So there's two main measurements that people use within the healthcare system. One is BMI, or the body mass index. I don't know, has anybody, everybody's heard of it, I think. So body mass index, and of course waist circumference. So body mass index is a calculation it's used to measure your height versus your weight and put you in a specific category. So normal weight individuals are between 18.5 to 24.9. That's what they consider normal. Overweight, a BMI of 25 to 29.9, and obesity is anything over 30 as a guideline. Waist circumference for females, a waist over 35 inches is considered a higher health risk, and a waist circumference of over 40 inches for males is associated with higher health risk. So some points to think about: BMI and waist circumference, okay? So what we're going to do now is we're going to move on to our first activity, and we're going to be creating a breakfast meal, okay? So what I'd like you to do is to come over here and
Okay, great.
come over here and I want you to put, okay, so here's bowls and we have cups over there for juice. So what I want you to do is not think about what you're having, and what I would like each, because there's 3 of you and I have 3 different kinds of cereal, so each one of you pick one kind of cereal. And what I'd like you to do is not think about that I'm testing you, so to speak, because I'm not, but we're just I'm trying to show some stuff here after the fact. So what I'd like you to do is take a bowl, dump your cereal in the bowl of what you typically would eat if you're on a Sunday morning by yourself. Nobody's around. What would you eat? How much would you put in your bowl? Okay?
No cereal there for that, but okay.
So do that, and then do the same thing for the juice. I have 2 different kinds of juice here. I have 2 different kinds of juice, a grape and like a fruit punch. So take your cup and pour as much juice as you would like to have. Again, how much you would typically have if you're not being really monitored like you are right now. Okay?
And if we wouldn't have cereal, if we're not cereal eaters?
If you're not serious, yeah. So just
do it anyway? Just
do it anyway. Yep, yep.
Okay.
How much you think, when you were a kid, how much cereal would you dump?
She has healthy ones there. I would probably choose Pops or Apple Jacks or...
Yeah, yeah. And I know, and I saw all of that too.
I wouldn't have a bowl this big, but, yes, okay.
Okay. So no, take this back
take
to
it with
your, yep. Well, yeah, get your juice and then take it back to your
Nice.
seat.
I've got
Yeah, you guys can go at the
Just
same
like
time.
this, the matters which one.
Yeah, you pick that one.
Okay.
That way we can kind of get a test for,
Oh.
It's a perfect size bowl.
No.
Full ice cream. Full...
ice cream. Okay.
Can I drink this?
Oh, I know this stuff's...
Not yet. Don't drink or eat anything yet.
Okay.
Now what I'm going to be passing out, once you get back to your seat, and you have pens in front of you, it's one for you, one for you, and then one for you. So don't eat or drink anything.
Okay.
So what I want you to do first is, the first question is, how many total calories do you think are in your meal? So just as an estimate, how much cereal and how much, I mean, you can, maybe do it separate. How many calories do you think are in your cereal? And then write that number.
Without looking at the box?
Without looking at the box, how much do you think as an estimate? And then how much for your juice?
Oh, this is in
No
the
milk?
meal
So you're-
or-
No milk, right?
No milk, yeah. Just what you're looking at right at the table right here.
Oh, see, you're doing this. You want 2 separate numbers, not.
That's fine.
Okay.
Yeah,
got a
yeah.
total number.
Okay, so 300, 100, 300, 170.
That was a total.
That was your total? Okay.
Yeah, if you want me to.
Can you break
down?
it? Yeah,
Sure.
might as well.
I guess simple would be, okay.
So 100 calories each,
Yeah.
okay. Okay, now what I want you guys to do is to actually measure out your cereal and compare it against the food label to how much you actually have to determine the actual calorie amount.
Okay.
Okay? So this is gonna take a little bit of time, so come back up here.
Oh. With our stuff?
Yes, and I got
Okay.
measuring cups. And if you need help, I can help you. So you have the right spreadsheet,
We're going
so.
to measure them out, right?
Yeah, and then just use extra bowls and, you know, dump it back and forth or whatever you gotta do.
Okay, so this is your punch.
Ooh, look at that. I was gauging it.
15 calories.
Look at that, oh, you had this one.
ounces.
Here's your poison, or
All the crunchy nuggets.
Is this a cup to do it or a cup to the pot? Must be,
to the whole top, because that's a half a cup in the middle.
okay, then I've got 1 cup, just shy of 1 cup.
So I would maybe just write that down real fast on your, and yeah, you can take that back and then
Maybe
we.
what I'll do is I'll use the 3/4 cup measure. Because I don't, this isn't quite a full cup. That's 2/3?
About 2/3 cup?
Actually, it's a little bit larger one.
I was pretty darn close on that cereal.
Let's see the white cup, or the clear. one.
Okay.
Now don't forget it, the clear one is a liquid measuring cup, so it might be a
Oh.
smidge off, but that's okay, no problem. As long as you're getting an estimate of how many calories we think we're having.
How would you like me to measure this into the bowl?
Is
You
there
want me to
more
join
cups?
another
Yeah,
cup?
take another cup.
Okay. I'm doing it.
Sorry.
You got the cup.
Are you about that here?
I get, oh, I
Because
get,
this is.
she does.
So what you're gonna have to do is write them down on your piece of paper. Did you bring all your piece of paper?
Yeah.
Yeah, I'll go get it. I think it's just a little bit more than 3/4.
Yeah, just a,
3/4.
I mean, rough,
Okay.
3/4 of a cup of juice. So then what you're gonna have to do is write it down and then come over
That's
here and
fluid
figure out.
ounces, so.
So 1 cup is 8 fluid ounces.
Okay.
And I can help you do the math.
Hold on.
You got yours worked out?
Over
Worked
3/4.
out, yes.
Okay,
I
which
think I
juice
got
did
it.
you have? This fruit punch?
Grape.
Oh, you had grape?
Yeah, do I have to mark that down too?
Well, what you're gonna wanna do is, okay, so you got the actual measurements?
Yes.
So then you're gonna want to write down, the calories
Okay,
are 90
all right.
per 8 fluid ounces. So we're gonna have to figure out the math.
This juice is actually good juice. Only 2 sugars.
What's the ounces on this?
Are you guys following what we're doing?
Well, we figure out what this was, right?
Yeah, so if you, whatever your, okay, you had a half a cup of cereal.
Mm-hmm. Which actually ends up being 300. Because it's 210, what's like 310? 315.
Yeah, so one cup
Was
is
210.
210 calories. So you had 1.5 cups.
Yeah.
Oh, okay, so you had to divide 210 by in half, right? Okay.
So I got 315
Okay.
total. But the juice is only 15.
Okay, and then you had, yep,
I only have a cup.
and you only had a cup.
Yep.
Oh, that's good, so you measured right out, yep, 8,
Yeah, I did.
so 15 calories, okay,
So I'm happy. I'm under.
okay.
If I would have added milk,
All
though,
right,
right?
and we're gonna talk about that. Okay, so where are you guys at
I almost had a cup in mine.
for your cereal?
Yeah, so I might have been right on with me. Oh no, I wasn't right on.
So
with
one
the cereal.
cup, yeah, so let's see, half a cup, I think this was, half a cup is 200 calories. Yeah, so you had 400, okay, that's right, yep.
Okay.
And then your juice, what kind of juice did you have?
The fruit punch.
So you had 15
Katie,
calories?
what's your
Yeah.
juice low
So what was your
calorie or
total?
no?
Well, it's 3/4.
I had the grape, I don't know how
So
many.
you
I only
got
had
a little
3/4,
bit.
so I had a little bit under
Because ours is
15.
only 15.
Yeah, so maybe like 12 calories,
Yeah.
let's say.
Mine was
Okay.
90 calories for 8 fluid ounces, but I only had 3/4 of a cup, so
So that's not bad.
So we can just shave off what, 15 calories?
yeah. So
It's
we'll
an
say-
estimate, that's how I do it when I
So
always did it.
15 calories, and then,
Well, shave off 15 off the 90.
Off the
'cause you had
90. Oh, all right.
Cindy, we've got my sheet.
so we're talking 75. Right?
Yeah. So 75 calories was your total for your juice.
No.
Okay,
my
and
cereal
then
was
my
14,
cereal
I
was
got
130 per half a cup, and I had 3/4 of a cup.
So 130 for a half a cup, and you had a quarter.
Usually it's not that
3/4 of a
bad
cup.
for-
Wait a minute, the serving size is
Yeah.
1 1/4 cups.
12.
Yeah, 1 1/4.
Oh,
Burn
okay,
it off
I've
all
only
day.
got half of that, so
I mean,
I've
it's very
probably got about 175.
So 70. So say 70. 70, 75.
Yeah.
Okay.
70 calories, yeah, for your cereal.
Okay.
That sound about right?
Yeah.
Okay. All right, great. So let's so everybody just go through and name or tell us what you estimated it to be and then what it actually was.
I estimated 100 calories for both, for each, for juice and cereal. And it actually turned out to be 75 calories for the juice and 70 calories for the cereal. So I was under
So you were under your initial estimate.
my estimate.
Okay, good.
I thought my cereal would be about 300 calories. I had a big bowl.
You, oh, okay, that was your estimate?
That was my estimate.
Okay.
And the juice I thought was going to be about 100 calories. I had a cup and a half of cereal, so it was 315 calories. And the juice was only 15. Yeah, a cup.
So your total was,
I'm sorry, my total was 400 was what I estimated it, and my actual total was 330.
okay, so you estimated over what you thought you actually had.
Yes.
Okay, so we have, okay. What about you, Cindy?
And then I had almost a cup of cereal, and I estimated that to be about 300, and it was really 400. But I thought my juice was maybe about 170,
Mm-hmm.
and it was really only 12. So I was still under.
Awesome.
Yeah.
Great, great. So, I mean, so what did you learn about yourself by doing this activity? Anything
You
stick
pay
out for you?
attention to portion control.
Mhm.
And for me, it would help to not have such a large bowl.
Okay,
Use smaller bowls for smaller meals, makes you feel like you have more.
right, right. So that's one of the strategies. And I purposefully got the largest bowl, and studies have shown that people will tend to consume more food, which in conjunction normally leads to more calories when they have larger serving bowls and larger cups and all that kind of stuff. So being mindful of that, I mean, that's a perfect, easy switch. Even plates. You know, the plate size is like a normal dinner plate. I forget the exact inches, but I don't know if it was 8 inch, yeah, 10 inches. Now it's a 12-inch plate or something like that. So it's funny when you see like a piece of chicken and a couple pieces of broccoli or a baked potato on a smaller plate. You're like, oh yeah, that looks good. And then when you put it on a large plate, you're like, how am I gonna, you know, I'm gonna starve if I just eat that. But it's the same amount of food, right? So, so why do you feel that learning this skill of measuring or paying greater attention to stuff like this is an important daily function of your life?
So you don't overeat and get diseases like that.
Exactly.
That's a lifestyle.
Right. It is a lifestyle.
And it's also bucking society. I mean, the society tells you supersize everything, you know.
Right.
I don't like supersizing. You know.
Right.
Like, supersize this, it's my water.
Right.
That's about it.
0 calories and it's beneficial. Has anybody watched the Super Size Me video?
Yes.
Yeah. What was your
My
thoughts
son
on that?
watched that when he was about 8 and he didn't eat at McDonald's for a year.
Really?
Yeah.
Wow, it had that much of an
That's
impact.
changed since then, but yeah.
Wow,
Is it on
that's
YouTube?
you know what it is, because part of my part of this lesson, which is in a different component other than today's lesson, involves actually having the students watch the Super Size Me video in different segments, and then we have group discussions on it, and going forward. It's,
I need to watch it again myself.
yeah, so great. So calories in general is, you know, a calorie is a calorie. I want to say that a calorie is a calorie, but it's what the amount of calories, one, and the types of calories that you consume. So take for example, you know, our breakfast over here. You know, if we look at the cereal, we can easily see that 1 1/4 cups of this Rice Krispie cereal is 130 calories, okay? Hardly any nutritional value, no fiber, but low in sugar. Not my first choice. The granola cereal is a dense cereal. So 1/2 cup of this cereal is 200 calories. So this is the type of cereal you have to be very, very careful with when you're dumping it in your cereal bowl because it adds up very, very fast. Same thing with Raisin Bran or any sort of added sugar cereals and stuff like that. When I was comparing just the regular Bran Flakes cereal without raisins to the Raisin Bran cereal, the sugar's almost tripled because of the raisins, which raisins aren't bad, it's just a concentrated source of sugar. Okay, so it adds to the calorie load. So, not saying to not eat that kind of stuff, but just be mindful of how much you are consuming. So, typically what I found in my practice is that a lot of times folks would load up on breakfast, and once we started doing the calorie breakdown, we would easily see some people were eating like 500-600 calories, sometimes even 700 calories at breakfast. Okay, and for some people that's almost their daily allotment. So it's just spacing those calories out, being mindful of what you are consuming, and you know, going that route. You know, and they were saying too, I found a couple of statistics in that they were saying 67% of Americans report taking calories into account when making food purchases, but nearly 9 out of the 10 have no idea how many they actually need on a daily basis. So again, going to somebody like myself, a registered dietitian, or some sort of other nutritionist to help you calculate out the calories that you need, either to maintain your weight or to lose weight, or perhaps maybe, you know, some people need to gain weight. But doing that, 1 pound of fat is about 3,500 calories. Okay, 1 pound is 3,500 calories. That's why to lose weight, it takes a lot more effort than, you know, to gain it. Because think about it, you have a double Whopper and fry and a large Coke. That's easily 1,500 calories, if not more, just off the top of my head, right? So have a couple of those a day, or what have you, you're already over, you know, and you want, you know, that's why it's so easy to gain weight, especially on the holidays. We're eating cookies all day and stuff like that. And cruise ships, Jen, you know, like Jen's going on a cruise next week, so I know I gained some weight when I went on my cruise, but it's the whole balancing act of balancing the exercise with the consumption and choosing your calories wisely. So, you know, just a couple breakdowns just to show you. Carbs and carbohydrates and proteins are 4 calories per gram. Fat is 9 calories per gram. And alcohol is 7 calories per gram. So you wouldn't necessarily associate alcohol with fat. I mean, it's not, but it's still it's very calorie laden when you consume it.
Sugar.
Yeah, absolutely. It's just a concentrated source of sugar. Right. So if you're not burning
That's the
it,
whole intent.
I know.
you know, if you're not burning it, then you store it as fat and stuff like that. So, so what are some? We started mentioning a little bit before. What are some things that we can do besides cutting down the serving size bowls and stuff like that? What are some other strategies we can do at home to, if we don't want to count calories, because I'm not saying to sit there and count every calorie. You don't have to do that. But what are some simple strategies without even taking much effort that you will inadvertently cut calories down?
Well, just not buying things that, not having chips in your house.
Not having chips, not having the junk
Yeah,
food.
at your disposal. But,
Okay,
it's an easy fix, don't buy it.
okay, good, good. What are some other strategies?
Would you call portion control and the size of your serving dishes the same thing?
No, yeah. No, I wouldn't call it the same thing.
Okay, then portion
No.
control.
Right, so again, some of the things like a deck of cards is about a 3-ounce portion of protein. Chicken, fish, beef. 2 dice, I think, is approximate for like a couple pieces of cheese, like 1 serving of cheese. Although cheese is very concentrated, not only in fat, but in salt. So a lot of people who are on high blood pressure medications and stuff, I always had to ask them, like, how much cheese do you consume? Oh, like about a couple bricks a week. I'm just like, whoa, you gotta look at the label because it'll tell you how much sodium you're actually consuming. But another great strategy that I always thought worked, that I told patients was to drink, and Nadine's doing a great job today, is to drink 1 or 2 glasses of water before each meal. When they sit down at the table or what have you, drink a couple glasses of water because it fills you up and you inadvertently consume less calories. So I think that's an excellent strategy and a lot of people use it.
I've also heard that you should eat more often.
Eat more often, right? So you're not, not eating breakfast and then, not eating all day. So by the time you get home, you're starving, and what happens? We all know we've been there, we've done it. Yeah, exactly.
Girl like this.
Yeah, and then you're like, I'm still hungry. And you're like, I'm still hungry. So then you go, I've done that myself. It's just bad business. You know what I mean? Because you don't realize how many calories you're consuming. So eating, I'm a big proponent of eating 5 to 6 small meals a day. You have a little something for breakfast, and you have a little snack, and then you have lunch, and you have a little snack. But you have to keep in mind, that's where calorie counting might come into play. Now, it depends on what you're eating. If you're having as your snack like some vegetables, 1 cup is about 5 calories. So that's what they say, to fill half of your plate with vegetables. Because the volume of it is so large and it fills you up, there's hardly any calories in it. That's the beauty of it. So, getting more bang for your buck. That way you're feeling like you're eating all day, large volumes of food, but you're not taking in the calories that's going to make you gain weight. So, what about some food preparation techniques? Would you put, back in the day, you'd take a big scoop of Crisco or lard, put it in the frying pan.
Depends on what you're making.
Right.
Ham's a great thing.
Ham, yeah. Well, I just found, olive oil, and actually they have this spray olive oil
Yeah,
now.
that's what I use.
Yeah, so I think that's perfect, like when you're frying up some chicken or something like that, or stir frying in your wok or whatever. It's a great addition in it. And even though olive oil is a monounsaturated fatty acid, it's a fat, 9 calories per gram, however, it's a heart-healthy fat. So any fats that you do consume, you want to consume the heart-healthy ones. So monounsaturated fatty acids and polyunsaturated fatty acids, okay? And you want to cut down on the saturated fat and the trans fat. So a lot of your full fat butters, margarine has tons of trans fat in it. So be leery of that. Any of your processed foods or anything like that, they have a lot of fat. So another big thing too, and I work with diabetics, is that low sugar products typically has more fat added. So it's a marketing, I'm not say scheme per se, but sometimes exactly, and it's a toss up because a lot of diabetics.
For the flavor.
Yeah, exactly.